our focus is educating doctors, nurses, midwives in the countries that we travel to. We work in partnership with them. Women all over the world die of the same causes: hemorrhage, infection, um, preeclampsia, and all of these things can be treated or prevented.
Let's talk about nutrition of a pregnant woman for herself and her unborn baby.
Good nutrition is essential for every mother. If they can take prenatal vitamins or iron supplements, eat diets high in protein, those kind of things will help the nutrition and help the mother to be healthier so that she can survive childbirth. The birth needs to be attended by somebody who's skilled, who can manage complications of pregnancy.
Doctor, we're talking during COVID-19, and a lot of pregnant women are worried and fearful of visiting the hospitals where they might get infected with coronavirus.
The COVID epidemic has added one more barrier for women getting care. The barriers already include poverty, distance from a facility, lack of information, and maybe cultural beliefs. Studies that we have so far show that pregnant women are not more susceptible to getting a COVID infection. And if they do get the infection, they're not more likely to die than an unpregnant woman.
Your career has taken you to some parts of Africa. Talk to us about where you went, what you did, and what needs to be done to improve the health of, pregnant women and their children.
Our first mission was to Chad. I was invited by a surgeon who said there's a great need for women's health care. And after that mission was very devastating for me. I saw too many women and babies dying needlessly. They came to the hospital much too late for us to do anything to help them survive. So we've worked in Chad, Nepal, Haiti, Uganda, and Cambodia. Our biggest mission at this time is in Uganda. We have created an OBGYN residency program in partnership with the local university. And we take teams of doctors, mostly professors, to Uganda and help to train the OBGYN residents.
What differences did you find, in terms of the healthcare needs for pregnant women and their babies in those different parts of the world that you visited?
In Nepal, they had to climb up a mountain to get to the health center. And you can imagine if you're pregnant and you're in labor and trying to climb up that mountain. So what we encourage them to do is create waiting areas so the mother can travel to be close to the hospital or clinic before they're in labor.
I'm thinking about COVID-19 right now, and some of the reports we are seeing from Africa is women not being able to go to the hospitals, mainly because there are curfews. There are lockdowns and there are only certain hours that you can leave your house to go somewhere. But labor pains don't know curfews or any of that. What should they do?
That's a really good question. If the government forbids them from leaving their house, it's they will be in danger. If midwives are able to come to their homes to help them deliver, then that would be the best thing if they could get somebody skilled to attend their birth.
What about places where there's no access to internet, there's no access to a hospital, and lack of finances, lack of technology that may be able to connect a pregnant mother with a doctor somewhere? What basic knowledge do such pregnant women need?
They're very simple kits that can prevent a mother and baby from getting an infection. And the kits just contain a sheet of plastic, gloves, soap, clean cords, and a clean blade, so that when the baby is born, they can cleanly and safely cut the cord and prevent the mother and baby from getting an infection.
Given the situation right now, a lot of people must be probably using social media to find midwives close to where they live. What kind of knowledge then should the midwives have?
And what I saw in the most remote areas of Africa, that almost everybody has a cell phone. So I think that what we can do during this time is to do telemedicine, do telehealth, meaning, use your phone to make phone calls to your community clinic or to your doctor or your midwife, and get advice directly from them.